Hello all. So 29th of September, we are celebrating World Heart Day. And this time, we want to increase the awareness about the heart disease, and the theme is know your heart. So if you know your heart, then we can prevent many type of cardiovascular disease. So as our sages told us about the great mantra that asato ma sadgamaya tamaso ma jyotirgamaya mritturma amritang gamaya. So we need to increase the awareness about our own self, our heart, and today we are really privileged to have with me Dr. Prantiki Halder. She is assistant professor at School of Tropical Medicine in the Department of Tropical Medicine, and myself, Dr. Shambo Samajdar. I am a physician and clinical pharmacologist at Kolkata. So we are today discussing about cardiovascular disease and some preventive aspects of cardiovascular disease. May I ask Dr. Halder that we know that India is the epicenter of cardiovascular disease now. The number is increasing day by day. So what is your thought and what is your observation behind this, we can say, epidemic of cardiovascular disease in India?
So India accounts for like 60% of world's burden of heart diseases. Now the reason may be as like South Asians, we are genetically more prone to develop diabetes and hypertension, which is contributing to the increasing incidence of heart diseases, because diabetes and hypertension, because they are important risk factors which lead to the increased burden of cardiovascular diseases among the Indian population.
Right. So I think genetically the predisposition is also that is contributing to increased incidence of cardiovascular disease in our country. And on top of that, we were very active before. Maybe 30 years, 40 years before, our activity level was very high. But now we become idle. Day by day we become idle, especially with the advent of this type of thing. I think our viewers now also viewing through us through some mobile, and that is one of the contributing factor for our idealness. So this all the lifestyle is something which is going to cause a havoc changes and increase this incidence of cardiovascular disease. So what is your take on that? How you want to address this issue and to tell our viewers regarding the improvement of their lifestyle? So what is your thought?
So we all know nowadays we are like focusing on healthy lifestyle. So whenever we go to a doctor for any reason, we are like always we are trying to create awareness what healthy lifestyle is. So what is healthy lifestyle actually?
Yeah.
So healthy lifestyle is like I think for me is we should have a proper diet. You should have like proper physical activity, regular exercises, and cutting down all the bad habits. So maybe your thoughts on that?
Yeah. So as you had rightly mentioned, that diet is something which is very important, and timing of the food intake. Most maybe if we go back to our 40 years, 50 years back, we generally finish our dinner by 8 p.m. like that. Even in some villages, we often see many people, they finish their dinner by 6 p.m. or maximum 7 p.m. But currently what we are practicing here, we are taking dinner at 12, 9 to even 1 a.m., 1:30 a.m. So that is something contributing a lot to this type of metabolic disorder. So diet is important, what we are eating, and that is why in Rig Veda they told aham annam. So what we eat, that we are. So we need to make our diet more physiological, more, uh, we may say more primitive diet. What we are going to this internet time,
Junk foods,
junk foods and
processed
that is the fast processed fast food, that we need to avoid. And especially, I think many of us are suffering from hypertension, high blood pressure. We need potassium. That is very important. And how many of us are taking 2 serving of fruits per day? So fruits are important. There are many fruits available outside. You need to take that. You have to limit your smoking. No, do not smoke. Do not take alcohol. Alcohol is also contributing. There were thinking concept like that. Even we know that the moderation of alcohol intake may be beneficial, but we know the Southeast Asian population, that study is not showing any beneficial role of even moderate intake of alcohol. So we need to avoid alcohol completely. Salt restriction. So that is also very important, and we need green leafy vegetables. The fish is good, but other animal proteins we need to avoid. The fish is good because we know the omega-3 fatty acid and even the omega-6 fatty acid, that ratio is very important in our if we consume fish. So overall, the minerals like potassium, like magnesium, like calcium, they are important for us. And this total dash diet, we always say diet, DASH diet is important for our hypertensive patient, but as well as this will be better for our people who are in the zone of high risk to develop hypertension. So apart from the diet, lifestyle, I think we are sitting in this place. This is a very famous football club in Kolkata, that is East Bengal club. So we need to promote sports. We need to promote physical activity. At least 30 minutes of brisk walking is extremely crucial for you. Apart from that 30 minutes of brisk walking, we generally recommend at least 3 days 15-minute resistance exercises. So you need to do your muscle building. So that is important, because in the muscles, if you are not doing proper resistance exercise, you will be again go into the zone of insulin resistance. So the insulin resistance will be high and you will develop lots of metabolic disorders. And also you need to practice yoga. So yoga is something which is essential for us. Yog means add. So when we talk yog, that means from I we become we. So again the illness starts with I, but if we replace that I to we, so illness will become wellness. So that is the essence of yoga. So we need to promote yogic practice for prevention of cardiovascular disease. Now my question to you, Dr. Halder, because yes, there are certain risk factors that we had discussed. The idleness, we are sitting more. That is why the recommendation are now to break your sitting. So every 30 minutes we need to move and do some level of physical activity and again do our own work. But at the same time, we saw many young guys who are dying due to cardiovascular disease, and they are otherwise they are very active. They are doing some gym, they are doing some good physical activity, but they are dying due to cardiovascular disease. So what is your thought on that?
So, few things I want to highlight is that thin doesn't mean that he or she is, perfectly fit. Even thin individuals can develop certain cardiovascular diseases. Why? Because there are certain other risk factors also. Now, what are those risk factors? Like certain genetic predisposition. So, any history of heart disease in the family. So, family history of heart disease is also important. So, in families where family members suffer sudden cardiac death, I think the other family members should be screened for the cardiovascular diseases from a very young age. So this fact we often neglect, but if we try to screen at a very young age for the genetic factors or for the family history of the heart diseases, we can save many young individuals also from losing their life to sudden cardiac death. So this is also very important apart from the other risk factors like diabetes, hypertension, or other metabolic disorders.
True, true. So gene is very important, and we do not know what is present inside our gene, but what we know that our family history. So if we have some strong family history, we need to discuss that with our doctors so that our doctors can advise regarding some screening procedures like that. My another query, because this is again a debatable issue, that after this COVID-19 pandemic, and as you were an infectious disease specialist, so what is your thought on that? Whether this COVID-19 pandemic, the COVID-19 infection, and this increased heart rate, heart disease, is there any connection?
Yes, we have seen that maybe few months after COVID diseases, patients are coming with different type of heart blockages leading to these cardiovascular diseases. There can be a correlation between this COVID and development of the heart diseases. Several studies are there, so there is a chance that post COVID the cardiovascular disease rate has increased, leading to there may be multiple factors. We need to do more research on that, but definitely there may be a reason that it has led to the increase in the number of the certain cardiac death.
True. So the thing is that, so the take-home message from the madam's point on this, the post-COVID increase in cardiovascular diseases, if you have any symptoms like shortness of breath, or you are feeling that your heart rate is going high or going too low, or you are feeling some blackout, or you are feeling some chest pain, so you need to talk with your doctor. And that is the motto why we are spreading this message, because you know that in the health system there is a triangle. One, in that triangle, one arm is obviously the doctors who are serving, who are treating you. Another arm is the healthcare system, that means healthcare other professionals like nurse, maybe pharmacist, the other regulatory persons who are making drugs, the industry. But the third arm is important, and that third arm is you. It is your healthcare seeking behavior that can complete this triangle and make you uh, healthy. So I think that is why you need to increase the awareness, and for that we are actually discussing. And if you have any type of symptoms as we had discussed, and you had a history of COVID-19 infection, so you should contact your doctor. And I think according to the clinical finding, that your doctor will suggest some test and some definite advice for you. So another important aspect is, as Dr. Halder had mentioned, if you are thin, you are not safe, but at the same time, it is important to note if your children is there who is sitting in front of the television, please educate your children to stop to sit in front of the television more than 1 hour per day. Even that screen time, the mobile screen time also should be counted. So no more than 1 hour screen time should be prohibited. We had done one very interesting study, Dr. Haldar, in this place, in East Bengal Club, with the children you can see who are practicing. So there is two cohort, two type of population we had taken. One, those who are very professional footballers, professional youngsters, who otherwise they were from the villages or some other clubs. They are coming to us. They are the professional team, professional young team, and another was the amateur one. That means those who want to learn football or from our cities they are coming. So we found that there is a huge difference in terms of obesity. This is a very important marker, the central obesity, and I think all of us can measure our central obesity now. Just use one tape, that is measuring tape, and if you are male and your abdominal circumference, that is over the navel, the total circumference, if it is more than 90 centimeter, and if you are female, if it is more than 80 centimeter, then you are in a very high risk zone. Most probably your inner organ like liver, like heart, like other organs, they are storing fats, bad fats, and that may harm you very soon. So this abdominal circumference is important. So we found the difference in the abdominal circumference, and we had done something more to see the insulin resistance here. There also we found the insulin resistance is very high in our amateur footballers who are practicing. So that is why we need to educate our people, our children, and our mothers should take the initiative, because you are the person who can involve your children to come to this type of grounds to play football, to play some sports. So this is very important, and at least for the children, they should spend 1 hour in the sporting field. So that is, I think, the most important message for their future healthy life. So my another take to you that there is one type of vaccine hesitancy even in our elderly population. So how you place the vaccine hesitancy in this type of scenario, because as an infectious disease specialist, you often see lots of patients are dying due to severe infection. So what is your take on them, especially when they are suffering from some cardiovascular disease?
So we all know that children need to get vaccinated. But with COVID vaccine, we we were able to make the population aware that adult immunization is also very important.
Yeah.
So maybe COVID vaccination helped us to create that awareness that adult immunization is also an important aspect of health. So COVID vaccination, we all know that people were like that time they were like very serious about getting vaccinated for the COVID vaccines. But at the same time, there are certain other vaccinations also, which I think all the adult individuals who are suffering, adult or those patients who are suffering from any congenital heart disease, or adult individuals suffering from any like cardiomyopathies or any like valvular heart disease. So in these all type of chronic heart conditions, immunizations with vaccines like influenza vaccine, pneumococcal vaccine, these are very important. It has been found that if this group is vaccinated with all these immunizations which are available for the adult age group, the risk of developing the complications with cardiovascular diseases is much less.
Yeah. Yes. So we need to increase the awareness about the vaccination too, especially as you had mentioned about the influenza vaccination and pneumococcal vaccination. And I think the herpes zoster vaccine is now also coming up. We need to promote that awareness too. Apart from that, when we are suffering from multiple comorbidities and especially diabetes, type 2 diabetes, we need to again, if I am a type 2 diabetic individual, we should follow the principle of ABC. We need to control this ABC. So A for A1C, HbA1c, or we can say the glycemic control. But for diabetes, it is not only about this A only. That means if your blood sugar is fine, so you are fine, that is not at all. So apart from controlling your blood sugar, you need to control that B and C. B for blood pressure. So there are certain threshold. In general, what we are now telling that our blood pressure should be less than 130 by 80 millimeter of mercury for all populations, except some elderly population, and the cholesterol. Very often, as a type 2 diabetic patient, we not take the cholesterol lowering medication, but that is very important. So when I am suffering from type 2 diabetes, it is important to control my LDL, and that should be very lower, not like those person who is not suffering from type 2 diabetes. And this is why we need to take this cholesterol lowering medication as per my physician's advice. Often we feel that, okay, I am taking this anti-diabetic drug, this is going to lower my glucose, so I will take this for my sugar control. But at the same time, when my doctor prescribe a statin group of drug which is going to lower the cholesterol level, so I think why I will take this molecule. I am not having that high cholesterol, so I will not take. So it is not right. If your physician is advising you to take that statin group of drug, it is important to continue that molecule, because that molecule will give you a benefit in terms of prevention of cardiovascular disease. Because if you are suffering from type 2 diabetes, so you have a very high chance of having of developing cardiovascular disease, heart attack. So we need to prevent that. So for prevention, we need to take the statin. So I think we discuss about various aspects of preventive approach to cardiovascular disease. And another thing for the elderly, because in India now the elderly population is also growing up, but at the same time there will be some problems like forgetfulness. They will not take the pill properly. So what is your advice on that? So how this issue of adherence or compliance to therapy should be promoted by us?
First thing is that the patient need to understand. The patient need to understand the importance of the disease and the importance of medicine. We often find that the patient, after taking medicine, he had some discomfort or some problems, and the patient on his own stops the medicine. I think this is the first step that should be avoided. Just knowing about the medicines through Google and then stopping the medicines on their own, it should be avoided. If any problem, then and there, that very patient should consult his own doctor regarding any problem. And the second thing is that the family members of the patient should also be aware, and they should also take that initiative and to see that that patient is regularly taking the medicine as advised by the clinician. So first thing which I want to say again, that only knowing about the medicines on Google, reading about it, and stopping the medicines on their own, it doesn't work in that way. Any problem, consult the doctor.
Very important, very important. And that is why, yes, so every drug may have some side effects. That is common. If one drug do not have any side effect, that means that drug do not have any effect too, good effect too. So we need to accept that. So it is when as a prescriber or as a clinician, physician, it is important to balance between that risk of taking the drug and risk of not taking the drug. So it is our duty, rather you should not your duty, to just stop the drug and forget about that. If you have any issue with particular any medication, you may stop it for one day like that, but you should visit your doctor, you should visit that prescriber to know about whether that side effect is related to that particular drug or not. So I think that message is clear, and if you are not taking the medicine, especially the chronic diseases like diabetes, hypertension and other chronic disease, so then you are going to face serious problem. So you need to continue your medications. I think we had discussed various issue today, and now we need to conclude. So what is your take home message for our audience?
So, at any point of time, we can develop any sort of disease. So, whenever you are diagnosed with a disease, you should immediately consult the doctor. The doctor is the best person to guide you, to inform you about the disease and inform you about the medications you need to take. Now, why we are hosting this session? Because our motto is to create awareness about the cardiovascular diseases. So, India being the global epicenter of diabetes, cardiovascular diseases are very common among Indians. So, any cardiovascular disease should be dealt very seriously. Apart from medications, healthy lifestyle has got a very important role, and Dr. Shambo has elaborated what healthy lifestyle means. And finally, apart from healthy lifestyle and risk factors, any sudden cardiac death in a family should be given importance. The family members should be screened in family history of cardiovascular diseases, and at a very young age, we should be aware about our own health, and accordingly, we should follow the measures.
Thank you, thank you. So to summarize, we need to take right food at the same time, at the right time. The timing of the food intake is should be right. Along with, we need to do some level of exercise. We need to promote a good sleep, and most importantly, we need to be happy always, because your happiness is the key to have a very healthy life, and of course the healthy heart. So thank you all. Wish you all a very healthy heart. Thank you. Thank you very much. Thank you, organizer, for giving us this opportunity to share our views with you all. Thank you.
Thank you.
So in this World Heart Day, our Dil Ki Baat is
Yeah.
beat the yellow, beat the bad cholesterol.